First of all, you're not alone. You're absolutely not alone. And there's nothing that you are going through that there isn't another human that can relate, understand, and listen. And if it's something along the lines of using substances or being afraid that you may have a disease, I will say I've been terrified by that. I've experienced what that stress and that fear can look like. And meeting somebody who is non-judgmental and can help you look at what does this look like? How can I heal my body? How can I move forward? There's a lot of, I would say, joyful energy in healing your body and knowing that you can have autonomy in the way that you choose to move forward. If you need any support, there's so many people out there that love you regardless and want to help you along that journey. So don't be afraid. Get tested, get treated, talk to people about it. It's way more common than you think.
Mental health champions, Vincent A. Lanci here with an exciting episode because I get to bring two guests on today. Thank you for stopping by to the number one podcast for mental health advocates and champions all around the world. We have two separate experiences coming our way, which I'm excited. Sarah has an incredible story after recovering from a substance use disorder. Now she has so many resources to offer to women just like herself, so stay tuned for that. Mr. Daniel Moore, Dr. Moore is out in Kentucky, and he is the founder and owner of Thoroughbred Emergency Physicians. So a lot of ground to cover in there, but I'm going to start with you, Sarah. Please introduce yourself to our audience, and then we'll get going.
Hi, I am Sarah Laurel. I'm the founder and executive director of Savage Sisters nonprofit. We do a couple of things in Philly. We have housing, education, and street-based outreach offering harm reduction to the community. So thank you for having me.
I love that. What was your inspiration for founding this company and giving back in that way?
I'm a person in long-term recovery, and I experienced going through the system. I really just wanted to start one house for me and a couple of my friends, and that developed into an entire organization, which I still don't know how I got here. But the houses are because I wanted to create an autonomous space for people to come into when they wanted to get into recovery. And the harm reduction happened after some traumatic losses. I went back to Kensington where I was using substances and I started doing outreach for my friends.
Making a big difference to start, and look how big of a difference you have made now. So thank you for all you do to give back through your story, your experiences. Everyone out there, you're not alone. She started out just wanting to help one or two, but in mental health, we know it does take a village, and you're building that. So congratulations on all the great work you do. Dr. Moore, please introduce yourself to our audience as well. We have all over the country today, which I love.
Sounds good. My name is Daniel Moore. I'm an emergency physician in Kentucky and have worked in academic centers and built a hepatitis C and HIV screening and linkage to care program, which is kind of what brought me to this. Also started a community emergency medicine group called Thoroughbred Emergency Medicine. Over my career, I've been involved in a lot of quality improvement type projects, and we can get into more how I got into this, but that's my background.
Yeah, what led you, just as I asked her, what led you to get here? I love to give our listeners such a close
Yeah.
connection with my guests.
It's kind of a convoluted story, but the projects that I worked on were really just looking at problems in the healthcare system and trying to have solutions. And when I was an ER doctor at a big academic center in Kentucky, I saw that a lot of people were dying from hepatitis C in particular. We saw a lot of kind of end stage liver disease. And as you probably know, this is closely associated with the opioid epidemic and injection drug use. And I knew that there was a cure for this, and I thought that I would be able to do something small, and I never knew that it would turn into something like this. But over time, just trying to get people cured of this disease, and it's turned into a big team, a big group that at our organization, and it was born out of just an effort to try to get people cured from a disease that I saw that was widely prevalent, and it's grown into a big project and a big program that we're trying to expand to different regions to cure people of this disease.
Well, to you as well, thank you for all the work that you're putting forward. Everyone, whether you're viewing on or listening on, they both have the passion for what they do, and that's what's really helping them make that big of a difference. I love also the patient-centered care that you're focusing on. one of my podcast production company, we have Voices of Experience, and it talks about patient experience and patient stories to help improve the process over at Tampa General Hospital. So big fan of the work you all are doing. People on the shows come in struggling in different areas, and the resources you both put out there, I think, can certainly help so many. Now, Daniel, when you're not working, when you're taking care of our upstairs, the mental health, what are some things you like to do for yourself to maintain a positive mental health with as busy as you are in this go, go, go world, multiple companies? What do you do to stay fit?
I try to work out as often as I can when I have time. I spend time with my family, sleeping. I don't have a lot more time for things other than that, but I think definitely sleeping and exercise and going to church and other things like that for my health are kind of the things that I need to stay on top of in terms of being healthy for myself.
Reflection, rest, exercise. These are things that when we're busy, we do tend to skip. But thank you for still prioritizing. Sarah, what are some things you do to take care of your mental health?
I do therapy. Basically, going through the traumas that we go through on the ground is a lot. So having support for my own mental health is really important. And I go to nature. I find a lot of peace in nature. I'm a city girl, so we don't get a lot of it. And I binge watch serial killer docs because I like the darkness of it.
Hey, you know what? You need to have your shows where you can, or your books even, just to decompress, separate yourself from the world. It's extremely important, and that looks different to everyone. I love to read. I'm not a big movie guy. I love TV shows because I like the stories in them. Of course, I'm a writer. I want to see each episode unravel and unfold. But Sarah, I'm going to stay on you here. Everyone, they gave me some great discussion points to shoot at them today, so that's going to help engage an amazing conversation. How did you find out you had hepatitis C? And describe that experience for our audience who may be in the similar shoes you were in.
Well, I was actually in a hospital and a nurse just kind of blurted it out and I dismissed it. I was actively using substances and not housed. And so I just went back to running. And then years later, after getting into recovery, I was in extreme pain. And I went to a hospital again and realized that I had some issues with my kidney. And they said, your viral load's pretty high. So I was able to treat it and take care of it then. I will say, I think it's a pretty intense thing to hear. Nobody wants to hear that they have a disease. And so I think the first time I heard it, I put it in a little box in the back of my brain. And I was like, well, we'll just add this to, the felony warrants and the homelessness and the substance use, and we'll pretend like it's not happening. But being able to deal with it in recovery helped me to focus on the treatment of it, just being physically well overall.
Was it hard at first to go into recovery? Were you all in on recovery? What was that process like?
No, and a lot of people don't like to hear that. I was actually
Well, honesty
got
is
in,
what I can ask for, so please.
I got into an altercation with a couple of the dope set boys, and I went out a second story window, and I was in the ICU. I had multiple surgeries. I had to learn to walk again. It was very traumatizing. That was when I started the first Savage House, and in that space, when I came in, I was like, I'm just gonna wait till I can walk again and get out of this wheelchair and get these staples out of my leg. And I'm just going to go back to Kensington because I know how to do that. It took a process for me to even take a deep breath without feeling like I had sand in my mouth. I couldn't breathe. I couldn't focus. I couldn't do anything. And after a while, I realized I think I had put 90 days together and I was like, oh, wow, I did not think I could do that. And I still was not hell bent on doing it. I was like, well, we'll see, because you love to run. And then I don't know, just one day after another, I just kind of put it on top of the other and things happened. The universe put things into my lap to focus me.
I love that. Well, congratulations on finding the strength and pushing forward. And now, as we started out, learning what a tremendous success she is. So keep up the great work. Now, Daniel, I know you're heavily involved in this field too, and I know you started the show building these centers. Let's talk about it a little more broad for people who may not be familiar. What is hepatitis C, and exactly how can it be transmitted?
It's a virus. Think of virus as you think of the flu or COVID or things like that. So it's a virus, and it's a virus that affects a lot of different parts of your body, but in particular your liver. It causes chronic inflammation of your liver. It can lead to end-stage liver disease, cirrhosis, liver cancer. A lot of complications of that. It's one of the leading causes of death in this country. It's before COVID was and is the number one cause of communicable disease death or infectious disease death, more than all other infectious diseases combined.
Right.
It's very prevalent. It's affecting a lot of people in this country. Probably close to around 4 million people in the United States have this disease, most of which have not been treated, and a lot of whom don't know that they have the disease as well. And with regards to how it's transmitted, it's a bloodborne pathogen. I mean, so the primary means of transmission that we see is through injection drugs. It can be transmitted through other things like getting a tattoo or through sex, but by far and away, right now, the most common transmission mechanism is through injection drugs.
You mentioned a little bit there how not everybody gets the care for it. What are some of those barriers to getting that care, Daniel?
There have been a lot of barriers. So, this virus hasn't been around in terms of our understanding of it for that long. I mean, in the 80s and early 90s, they didn't really have a name for it and didn't have a test for it. And then once they started developing treatments for it, it was almost like chemotherapy. So a lot of doctors weren't putting their patients through the treatment.
Right.
But in the early 2010s, they developed a cure. They're called direct-acting antivirals, and it basically cures almost 100% of people. They're just pills. But most doctors that I've come in contact with that are practicing out in the community have told their patients in the past. So the patients that do know that they have the disease have been told at some point that they're not eligible, whether that is because of the side effects of the medicine. There have been a lot of barriers to get access to the treatment, which are currently dropping pretty rapidly. Some of those barriers in the past were proven sobriety. You had to be off drugs, or proven fibrosis. You had to have advanced liver disease. You had to have a specialist prescribe the medication. You had to jump through hoops to get your insurance to cover it. So all those were barriers in the past. And then other social barriers as well. I mean, just competing priorities of, actively using drugs or being incarcerated or not having insurance or whatever. There historically have been a lot of different barriers, but there's been a lot of movement over the last few years. So a lot of those barriers are gone. In most places, insurance is covering this now because it is cost effective to do it. Took a while for them to realize that. So a lot of the things that I mentioned are gone. And so, a lot of what we're trying to do is raise awareness that pretty much everybody should be tested. At least in my region, I'm able to look every patient in the eye and say, if you'll follow up, we will get you cured of this disease. It's a comforting thing to be able to tell patients. But big thing for the listeners to know is that the barriers that I talked about are gone or going away.
Thank you for sharing that. And everyone, creating awareness for the causes we believe in. You have to go out there and share your story. Daniel does a great job. Sarah does a great job. And Sarah, I know you are very, very big on speaking about this during Recovery Month. Let's talk about some of the work you've done during that month and why it's so important for you to speak specifically then.
Recovery Month, I think, is a great time to celebrate people who use drugs, whether they're currently using them, whether they're in a form of recovery that the society deems as acceptable. I think it's a really important month to talk about ending stigma and reach individuals who feel connected to recovery in one way or other. The work that we do when it comes to the harm reduction, I have recovery houses, we offer therapy, kickboxing, yoga, we do all those wonderful things, and we celebrate those individuals in such a wonderful way. But especially right now, we're trying to reach the folks that we serve that are in different pathways when it comes to recovery and let them know that we're connected to them. They're a part of our community. We love them. We're here to serve them and talk to them about different resources that they can access and what their recovery journeys might look like. It doesn't have to look like what other people tell you it has to look like. One of the most important things for me is physical wellness and health. And that's something that I put on the back burner for a really long time. And the friends that we serve specifically in our outreaches, we're harm reduction. So we do a syringe program and we talk about these things. Access to syringe programs right now is kind of limited because people have a very weaponized agenda against harm reduction and they don't understand the correlation to how it can positively impact people and lower the rate of infectious diseases spreading. It's much more difficult to get into your recovery journey, whatever that may look like, when you have a list of things that you have to overcome, whether it be the judicial system or a disease that you may be afraid of. And I also think that we need to talk about the education. When it comes to Hep C, there's a lot of myths in our community about what it looks like, how the body deals with it, what those barriers are, what's real and what's not. So we are very loud advocates in our community, but Recovery Month is just a special time for us to scream into the echo chamber.
I love how you both at different times talked about physical activity while we're talking about mental health. I'm always
Mhm.
getting more mentally out of anything I do than physically. Of course, the physical benefits is what most people want, but for me, I work out every morning. I'm a little abnormal. I do my exercise at 3:30 in the morning every day, but for me, I don't think clearly without that exercise, whatever it may be. I start overthinking. I'm not rational, my thoughts, and I'm not focused. All of these things improve with a little physical exercise. Thank you for sharing that. And thank you again for being such a loud advocate. Sarah, at the end of the episode, we'll of course find out all about your houses and those resources. But when you were at this stage in recovery, what was a resource that you were able to rely on that helped you?
While in recovery or while I was out there?
Any either or, just something that worked well for you.
I kind of built my own program because Savage is the beginning of my journey when it comes to
Amazing.
recovery. But I will say there's a large organization in Philly known as Prevention Point, and I don't know if I'm allowed to say that, but they were there to help with a ton of different things. And
Right.
STI testing was a big thing, treatment and different things like that. That was super helpful. I was able to get into therapy and I was very opposed to it, but eventually I was able to get into therapy, which I think played a big part in my recovery journey. And I started working with strong women that were on the recovery path that kind of guided me through different experiences. So I think the combination of all of those things coming together really helped me. In Philly, we have some really incredible organizations that offer different resources for mental health, physical health, and spiritual, if you will, because Reiki and yoga are considered spiritual.
Thank you for sharing all that. And it is great that there is such a heavy advocate in that field. And I know you're relentless with it and you're going to keep pushing. And I can't wait to see how many more lives you continue to impact. So it's very exciting for us to be connected now so we can stay in touch. Now, Daniel, what are the most important things our listeners should know about hepatitis C that we did not cover yet?
I mean, we've kind of touched on the most important parts, but I mean, I think the most important thing is to know the prevalence of this, just how unbelievably prevalent it is. In emergency departments, it's close to as prevalent as high blood pressure. We're finding 1 in 10 to 1 in 20, and even 1 in 5, depending on you look at the age group of patients who walk through emergency departments. It's particularly in younger patients between 20 and 50, which is largely the patient population that's dealing with injection drugs, have been exposed to the hepatitis C virus at some point. I mean, so I would say you just understand that pretty much everybody nowadays is recommending that everyone over the age of 18 get tested. And that is recommended by big organizations like the CDC and United States Preventive Task Forces. Insurance companies have gotten behind it. So I mean, I think that the reason that I'm here today is just to spread awareness of how prevalent disease is and that you should get screened and to understand that there's a cure and that there's hope if you have it. Obviously, we're here talking about mental health. We've been talking about injection drugs, and just at any point along your path that there is hope for this and that there is a cure for this. So just to put that in the back of people's minds, regardless of where they are in their life and their journey.
It's not about where we are right now, but where we find that courage inside of us to move forward and find the brighter day that we all deserve. Tough times don't last, but I promise if you're listening to this, you have the strength inside you to keep going. Stay with us. Before we get all these great contact information, trust me, there's your two folks you're going to want to be in touch with. I'd like to close off with asking for one piece of advice from each of you for anyone who's having a really tough time right now.
First of all, you're not alone. You're absolutely not alone. And there's nothing that you are going through that there isn't another human that can relate, understand, and listen. And if it's something along the lines of using substances or being afraid that you may have a disease, I will say I've been terrified by that. I've experienced what that stress and that fear can look like. And meeting somebody who is non-judgmental and can help you look at what does this look like? How can I heal my body? How can I move forward? There's a lot of, I would say, joyful energy in healing your body and knowing that you can have autonomy in the way that you choose to move forward. If you need any support, there's so many people out there that love you regardless and want to help you along that journey. So don't be afraid, get tested, get treated, talk to people about it. It's way more common than you think.
Thank you for sharing that incredible note. Daniel, over to you.
I'll be honest, I'm not the expert in mental health, but I do think that emergency departments and emergency physicians and nurses that work in emergency departments are one of those groups of people that Sarah mentioned in terms of people who love you. Sarah mentioned, at a previous engagement that sometimes people may be afraid of the healthcare system or afraid to ask for help or afraid to ask for treatment or testing. And I think what I would want to tell your listeners that if they're having a rough time, that emergency departments exist pretty much everywhere in the country. Yeah. And people that have gone into emergency medicine, nurses, physicians, anybody working there, they truly are there because it's a hard job, but they're there because that they love the patients. And don't be afraid to go ask for help, especially with suicide and things like that. Something that we've seen many, many, many times. Any ER doctor in the country has personally witnessed this many times. We take it very seriously. We want to help. If you have issues with addiction or with any other aspect, if you're worried about the infectious disease component of this, that healthcare professionals are there to help and we want to help. And please don't be afraid to ask for that help and seek that help, because you're going to find loving people on the other end of this.
Another great message to sign off. I have to thank you both so much for coming on the show. A special shout out to Tiffany for putting it all together. And of course, a special shout out to you, the listeners who are prioritizing your mental health. And I look forward to keeping the conversation alive next week. But in the meantime, let's hear how we can get in touch with Sarah and Daniel.
You can find us on all social media platforms, Savage Sisters Recovery and savagesisters.org. Feel free to follow us on Instagram, Facebook, TikTok, and we have a lot of fun videos talking about the work that we do and ways that you can get involved remotely, or if you're in Philly, stay savage.
Thank you.
So probably the best way to contact me would be my email address through the university where I work. It's jdaniel.moore@uky.edu. Available for any types of discussion or help, or if anybody has any questions with regards to treatment or testing, I'm happy to answer those questions. But that's probably the best way to get in contact with me. Our team doesn't have a big social media presence or anything like that. So
it's all right. I appreciate you both sharing how our awesome, loyal listeners can get in touch with you. Everyone, thank you for tuning in. The show is at A Mental Health Break on all podcast platforms. We're out there on social media too, so support us there. If you enjoyed today's episode, please remember to leave us a 5-star rating and a review to help others join our conversations on mental health. If you want to connect with me further, I'm at Vincent A. Lanci on all social media, YouTube, and my website is vincentalanci.com. This week's show is brought to you by Coming Alive Podcast Production, your one-stop shop for podcasting. Head to comingalivepodcastproduction.com to get started. But with that, today we are signing off from this time New York to Philly to Kentucky. All thank you so much again.
thank you. Have a good day.
Thanks. Have a good day.